Well, good evening, everyone. Thank you for joining this very important topic. Welcome to Rose Wellness Seminar. And the topic today is stress, sleep, and energy. We realize this is a very timely topic with the holidays coming, the days getting shorter, the daylight savings and everything else. And it is my honor and privilege to be here. My name is Harpreet Gujral. I'm a DNP, a doctorate in nursing practice and integrative health and healing. And this topic is near and dear to me. So we are looking at a whole body approach to women's wellness. And today's objectives, we are looking at how do we achieve whole body wellness? Well, first, we need to understand what is the mind and body connection. And, we live in such a fast pace, and I welcome people from Florida, Tennessee. There are people from Virginia and Maryland and DC and New Jersey. So, as we are working through very fast paced society, it is important for us to recognize that mind and body are always talking. So we'll talk about how to see that connection and how that undermines or helps us to deal with the types of stressors we go through. So there is the good stress, which is eustress, and there is a bad stress called distress. So we'll differentiate between both the good stress and the bad stress, so eustress and distress. And we'll learn how cortisol, estrogen, thyroid, and insulin interact between each other. So this very beautiful interplay between all of the hormones that there are lots of buzzwords now. Everybody talks about cortisol and women's hormone, etc. So we'll talk about that. The next objective is to discover functional medicine strategies to calm stress, restore sleep, and sustain energy so we can enjoy the holidays and enter into the new year, the 2026, feeling more rejuvenated and have better understanding of how our body works. And lastly, we will explore role of lifestyle rhythms, the circadian health, the nutrition and movement to look at this connection and how to restore our hormones in the ways we can through our lifestyle. So we'll go ahead and start looking at this. So I wanted to talk about how the mind-body connection why is that so important? Well, I have to say, and maybe I'm a little biased, there are men in this room too, but I just have to say, like most women that are going through perimenopause, menopause, are actually coming to us with the reports of fatigue. They're not sleeping well during their midlife. They're sandwich generation. They're professionals, or maybe they're at home taking care of the home and the children, or they're professionals who are doing all of that and taking care of the parents, the aging parents, and helping their growing family. So given that, they are noticing, even though there is a lot of stress, they're noticing their body is not keeping up with the amount of things that we have to do. So this chronic stress can continue on, like for some time our body is managing well, but when it continues for a long time, it can lead to hormone dysregulation. So our hormones can be off, and that can drive inflammation, which, as we know, 70% of chronic disease is caused by increased inflammation. So stress can cause more inflammation and accelerate aging. You might notice there are people who are, 50 years old and they look like 35. And then there are people who are 70 and they look like 55. And then there are people who are on the younger side, but they have aged drastically because something bad happened, something unfortunate has happened, and they have noticed like this chronic stress that's going on has led to increased aging symptoms on their body. We'll also look at how to understand this interconnection that happens that leads to long-term health decline. And the reason we are gathered here because we want to understand that and prevent that from happening. We want to stop that from happening to us and we want to see what can we do preemptively, preventatively, or if you're going through such a challenge, how can we get support that will help us to mitigate this stress and lower the inflammation. So as we look at the mind and body connection further, you might have heard the letter HPA axis, hypothalamus, pituitary, adrenal axis. As you know, pituitary is the master gland. And so when there is too much stress happening, our hypothalamus produces certain hormones that upregulate other hormones and asks the adrenal glands, which are little cashew-sized glands that are on top of our kidneys, one on each side, and it is asked to produce more cortisol for us to do our job. And so this leads to, there is the hormone secretion, but there's also the perception. So HPA axis links stress perception underlying with the hormone secretion. So for example, if there is a certain challenge and I say, well, you know what, this is rough, I'll deal with it because I have good support system in place. I'm going to spend time in nature. I'm going to make sure that I'm continuing to eat healthy. My perception of that stress might be a little bit different than the next person who might perceive it as, why is this happening? There's resistance, and they may not, have all the support system in place and find that stress to be, much bigger. So the perception really makes a difference as well, as to, in addition to the amount of stress we are experiencing. Chronic stressors lead to more cortisol production, which is produced in our adrenal glands, at the cashew glands I mentioned on top of the kidneys. This will trigger inflammation. Well, short term, that is okay. It is giving us, more cortisol production to energize us and gets us out of the bed, gets us to, achieve the goals we need to do. But when it is ongoing, it leads to further inflammation. And that also affects, the cortisol affects our blood glucose imbalance. And we're going to look at all these hormones interplay in subsequent slides of how these each talk to each other. And as a mindfulness teacher, meditation teacher, I am biased. So I remind us here on this slide that mindfulness has been shown to reduce amygdala, which is our reptilian brain. So we had this, brain. This is the, our sophisticated brain. And here's the amygdala, which is reptilian brain. So it hides underneath, and we are always using our sophisticated brain. But when too much stress or a lot of, we get triggered, the smart brain, the sophisticated brain, opens up, and we have amygdala that gets activated, and we can experience a lot of sympathetic drive, lots of emotions, etc. So mindfulness is allowing us to not flip the handle, not flip the lid, and keep it on, so we are able to stay more engaged, focused, and make improved decisions using our very sophisticated brains. So as I was talking about stress, and I mentioned stresses, there is good stress and there is not so good stress. Eustress is the positive stress that actually gives us the motivation, gets us out of our bed, leads to goals and projects, etc., being done. Things that are on our list, we can check them off. It gives us that. So that is actually a good thing. It enhances resilience. When the good stress is turning into something that is more than our capacity, or it's leading to overwhelming and long duration and higher stress, can throw us into the distress, where the overwhelming stress is leading to anxiety, insomnia. We are stimulated, we're tired, and the brain is not resting. We lay in bed and we are wondering, we're ruminating, etc. So the dose of the stress and duration of the stress determines how it's going to impact our body, how much inflammation might we go through, and how our hormones will get affected from that. So that's the difference between eustress and distress. And here's the connection of how our hormones, stress, and health matters. So there is a beautiful symphony between our hormones. There's a crosstalk between our hypothalamus, pituitary, thyroid, ovarian, and adrenal glands. There's a beautiful talk, back and forth exchange happening. And when perimenopause or menopause, when there are estrogen is getting deficient, we start to notice that our body starts to make more cortisol. So we are laying in bed, not able to rest. We're having insomnia. We're tired and exhausted, and our brain is racing. And we start noticing this midsection weight gain. We have not changed anything. We're still eating healthy. We're going to the gym. We're working out. And this weight gain starts to happen. And that is because the cortisol is increasing, because our body is trying to really keep up with what it's going through. It's really has equilibrium in its mind. So it's really working towards that. So as we see, the cortisol is the master stress hormone. However, when it's chronically elevated, it leads to disturbance in sleep, it leads to metabolism issues, it leads to higher inflammation, etc. On the right side, the pink, where you see the estrogen, that is responsible from head to toe functioning. So it helps us with mood modulation, where I see women all the time where they will say, Harpreet, I am not sure why am I having such a bad mood? This is not my baseline. I've become this, not a nice person. I say things that I really don't want to say to my family, and I'm concerned. I say these things at work, which can get me in trouble. And so we know that when estrogen is low, we start to notice that there are changes in the brain. The brain receptors are waiting for estrogen to arrive, and we start to notice mood changes. We're having brain fog. We're having memory issues, also remembering words, certain words. So people are noticing a lot of difference in how they're feeling, and how they're performing at work, and also how they're showing up at home. Insulin, on the other side, is produced by our pancreas. And so this impacts our blood sugar stability and also our energy level. When we have low estrogen, we start to produce insulin resistance. That means our body needs to make more insulin to do the job it was doing before, but it's not as effective. So I hear it all the time where, my patients would say, I'm not sure why I am pre-diabetic now, why my insulin hemoglobin A1C has gone up, and my mood is not good. I'm gaining weight in the midsection. I'm, not sleeping well. So also when we check their blood test, we find in the thyroid, which is for metabolic rate and energy, people are noticing they have fatigue. Their thyroid numbers have changed. So all in all, you can see the cortisol, estrogen, insulin, and thyroid get affected when we are in stress and when our hormones are changing with perimenopause and menopause. So as we saw the interconnection, let's look at mostly, first, how does the thyroid change, right? A lot of us, when you get your thyroid checked, thyroid gland, as you know, is located right here in our throat. And we mostly produce T4, which is the most abundant hormone, 80% of the hormone. And this T4, the inactive hormone, converts into active form called T3, and also the reverse T3. T3 is the most potent hormone that actually gets into the cells, gives us more energy, gives us improved metabolism, and helps to govern our metabolic switch. So when we have chronic stress, both T3 and T4 conversion gets affected. So we're not converting efficiently the T4 into T3. We also start noticing that reduced estrogen is now making more spikes in cortisol sensitivity, and we are having higher blood sugar. Insulin resistance leads to inflammation. We start to notice more weight gain. We're noticing that we are having issues with our inflammation, and the body feels inflamed. I hear it all the times. I have had the good honor of working with hundreds of women, and women say, why I feel so inflamed, I feel so swollen on the inside, and I'm trying so hard to be healthy. What is wrong? Like, what is going on with my body? Why is this not listening to me? And I remind women that your body is your friend. It has been trying to work. It's really very sophisticated, and it's been working towards creating that balance. So the cortisol connection, let's take a look at the curve, and I will show you a picture so you'll be able to see and appreciate that. I'm a visual, so for me, I love to see pictures. Ideally, what happens is we wake up and we have nice and high cortisol, and then it stops, it peaks at, and then it starts to drop down. And by the time night comes, the cortisol has dropped down, and we start to make more melatonin so we can rest fully and be ready for next day to have the cortisol up again, so we can, jump out the bed, do the things, the beautiful things we have to do in the day, and enjoy our day, only to have slumber at night. However, with ongoing stress, our adrenals are so burnt off, so tired, we have been withdrawing from our savings account. So initially, the checking account looks very good. We are good energy, we're still keeping up, we're, going around and doing things. But eventually, when the savings is depleted and the checking is down, we start to notice we're feeling burnt out. We are feeling the mood is off. We're not sleeping well. We are just exhausted. And that is, you see a very flat and reverse curve of cortisol. And I will show you that picture. So it's really important to understand what is exactly happening and actually doing functional medicine testing. So there is the Dutch test or a 4-point salivary cortisol. Either of those tests can actually give us a very nice understanding of what is going on. So that's why we use the functional medicine lens instead of just putting a Band-Aid and saying, your labs look good, or your labs look, this is wrong, let's give you this pill for that. And, putting some Band-Aids on, but not really looking at the root cause. And I know our community is very frustrated. I know people are advocating for their health, and they're looking for answers, not Band-Aids. And so here at Rose Wellness, it's really important to us to help you figure out the root cause and seeing why is this imbalance happening. Not just the symptoms, but really understanding why is the imbalance happening. So we do detailed diagnostic testing that gives us a clear idea, a personalized understanding of what's going on in your body, and what's looking at your hormones, what's going on with inflammation markers, and how is your metabolism going. So we look at a personalized nutrition, lifestyle, and supplemental protocols because, there are thousands of supplements out there. Which one are right for me? Do I need everything, or should I just be taking the specific ones that are based on my testing? So it's really important. Dr. Google is very helpful sometimes, but also not so much. So I think it's really important to make sure that we have the right testing. For example, on this screen, you can see the sample testing for hormones. So this is Dutch test. It looks very complicated. However, we sit down with you. We look at each of these pictures, and we look at how is your body processing various hormones? What is happening with the cortisol? So for example, and on the right side, you'll see it will talk about, these different sex hormones and its metabolites. How is the metabolites? So it's really important for us to also not just throw, some hormones at people and say, okay, let's see you start to get better. It's really important to understand, how are you metabolizing these hormones? What is your liver's capacity? What else are you dealing with? And so we look at how are the estrogens metabolizing into certain, metabolites. Is it safe for you? Is it, do we need to do something special for you, given how you're metabolizing the hormones, the phase 1 and phase 2 reaction, etc. So we talk about all that. This is part of our consultation when we're meeting with you in our office. We also, so here is the sample testing for the adrenal hormone. So as I mentioned, on the left side, you see the face here with the stress. There's hypothalamus, pituitary, pineal gland. Pineal gland, even the pituitary gland is the master gland, pineal is the actually controls the pituitary. And so stress causes the brain to release ACTH, which can stimulate more adrenal gland functioning. And so as you can see this, this orange beige adrenal gland, and this produces, its job is to produce the DHEA and the cortisol. And that can be off. And when you look at this pattern down below, this graph here, you can notice that how the black line is representing the person whose urine this was, dry urine test was. And then there is a higher range that, is there. But when people are having a lot of stress, this can reverse, and they actually can have very little cortisol when they wake up. It doesn't rise, and then they have a higher cortisol as they get closer to nighttime. So we look at these information, closely, and explain this to you so you understand what is the body doing. And let me ask you, if and you can put in this chat if you want, if there are dysregulation of the stress, what is the cost that we're paying for that? Are people having weight gain? Are we having brain fog? How is our concentration? How is our memory? Am I walking into a room and then wondering, why did I come here? and do I have to go back and tread my steps backwards and come back again to figure out what did I need in the first place? How are my blood sugar and responses? Am I feeling hangry often? So looking at blood sugar imbalance, looking at insulin resistance. How is the libido? A lot of women, when I ask them about libido, they're like, oh, I'm fine. I just, I don't have any symptoms per se of perimenopause or menopause, but I like to keep my bedroom really cold. And I tell my partner not to touch me. And I get angry at my kids because I don't understand why are they talking like this. I get really upset. But no, I don't think I have any symptoms. And, it makes me smile and sad at the same time, because as women, we're so resilient. We're always trying to navigate our lives and, just plow through those symptoms. So I think it's really important for us to pause and understand, like, if we are having dysregulated stress, we're having any of those symptoms, we don't have to have all the symptoms. What is the cost of these symptoms that we're paying every day in our life? Okay. So how do we restore our HPA axis, the hypothalamus pituitary adrenal axis? What do we do? Well, first we should know what is going on. So we identify what is the cortisol rhythm by testing. Once we understand the graph, how the person is doing, then we sit down together and figure out a personalized plan to support the adrenal recovery through adaptogens, supplementation, and nutrition. And what are the lifestyle changes? I was just meeting with one of my new patients today, and we talked about how to slow down. Like, she works out 7 to 8 workouts a week. And, she's on the go all the time. The cortisol graph is almost flat. It's not rises. She wakes up with very low cortisol, but through her very strong self, she propels herself out of the bed and goes to work out. But there is a price that we are paying in that. We have emptied our savings account, and we are looking at, really the adrenals have been burnt out. So it's really important to, pause, slow down, include some awe, include gratitude practice, slowing down and saying, what does my body need to create this adrenal recovery and support system? And what happens is, a lot of times it can be very daunting when you're trying to do this all by yourself. It's really hard, to start. There are so many complicated and sometimes also very opposite, instructions and theories out there. So which one are we going to follow? It's really important to make sure that whoever you go to, you're going to someone who understands the physiology, that understands the functional, root cause analysis, and can sit with you and understand and show you how we can create a personalized plan for this adrenal recovery. And how can we balance the thyroid and insulin pathways? As you saw how they were interconnected, there's a better understanding now because we know how these hormones are talking with each other, how the HPA axis is working. We're able to nourish the adrenal glands, help support the thyroid gland, and make sure that our hormones are balanced. Now we can be thriving because we have rebalanced our thyroid hormones and our insulin resistance has been resolved if it was there. And now we have more energy, more, energy and resilience to deal with our day, and we can handle those multiple priorities. But I don't say that we that we have to be able to do everything. I also encourage my patients to look at what is it that you can remove from your list, what can you say no to, and listening to the body and being more authentic and not falling prey to the people pleasing or having to put ourselves on the back burner. So it's really important we look at all of you as how to best support you. So, and everyone is different. I have people who are very much advocates of themselves, are doing everything that they can, and they know when they do that, they're actually able to give back more to the family, to work, to society when they've taken care of themselves. And for me, this was something I had to learn. So so I sit with my patients and really look at how to best support them. So sleep, as you know, if I were to write 2 prescriptions, the first prescription is going to be for sleep. I would ask you to please sleep for 8 hours. As you know, sleep is the best anti-inflammatory drug there is. So many women come to me and say, I'm up at 2 a.m., I'm up at 3 a.m., I'm up at 5 a.m., and I just am not sleeping well. And then they're waking up to go to work eventually after 3 or 4 hours of sleep, and they're showing up, trying to do the best work they can. And this is really hard. It's not sustainable. And we know that it leads to more cortisol production. It affects our thyroid gland. It affects our estrogen hormone balance as well. So chronic insomnia can really lead to, and it can age us very, very fast. It can also lead to high insulin levels. So our insulin resistance can happen. We end up with prediabetes, diabetes. And so it's really important to make sure we are focusing on sleep. So that is number 1 prescription that I would, like to write for people. And number 2 is nutrition, right? So we want people to have cortisol improved, insulin resistance better, and they are helping having healthy cortisol rhythm. In terms of functional nutrition, that's my second prescription that I'd like to write for people, is looking at what foods should we eat that are going to bring in hormone health. As you know, food is medicine. So for us, it's really important at Rose Wellness is to, meet you where you are. Another patient I was seeing today, and she was like, Harpreet, I do not like to be in the kitchen, So, and that's really fine. We have health coaches, and it's wonderful where we meet the woman where she is and figure out how to support you based on your lifestyle and focus on anti-inflammatory foods that are balancing your blood sugars, that are giving you energy and adequate amounts of energy to support you, and certain foods that are going to help you with detoxification. It's helping your liver to help with in removing the toxins out of your hormones, and better estrogen balance. So we create that personalized meal plans, based on what exactly are the lab findings, the blood test, and what you need versus just some, blanket recommendation. So with metabolic restoration, it's really important to support thyroid, cortisol, and insulin optimization. We, as you know, mitochondria are our little cashew. Also, they're like small little micro, obviously, organelles in our cells that are producing energy for us. So when we have high toxins, are more stressed, not sleeping well, hormones are off, our mitochondria go through this concern about cell danger. Like it's where our body is saying there's something not right about this, and our mitochondria may not be producing optimal amounts of energy. So women will come in and say, I'm very exhausted, I have no energy, I'm just pushing through. Some women will say, I wake up in the morning and I'm like, when will 9 p.m. come so I can actually lay in bed? So our goal is to reduce inflammation and aging, stopping the aging acceleration that is happening. So I will mention another woman. This is our case study I wanted to share with you. So she's 48 years old, and when she came to us, she was struggling with not sleeping, waking up at 1 and 3 a.m. and 5 a.m., very fatigued. She was having this meno belly, this midsection, fat all in the waist. And she just could not believe it. Like, she has been an avid exerciser. She's eating organic. She's walking, doing lifting, etc., but just could not shake off the weight and just couldn't get to sleep well. So when we did the testing, we found that she definitely had very low morning cortisol. Her cortisol, graph was almost flat, and her thyroid function showed that her TSH was is elevated, and her numbers T4, T3 are not doing well. They're actually on the lower end. So we went through this. This takes obviously, some time and very intentionality, lots of personalization, and then creating a plan that was specific for her, looking at what kind of nutrition, what kind of testing, how to support her, whether, we meet you where you are. So if you say, well, I want to, just do the supplement, I do not want a prescription right now, we work with you on that. And some people might be vice versa. So looking at how to support your thyroid, how to create this adrenal, nourishing the adrenal glands again. And it was beautiful to see how she was able to sleep well, and, and able to gain that energy back, and noticing, some of the midsection, the weight was starting to drop. Once her hormones were more balanced better. So the real results, are important, but also looking at what are the underlying causes and working on those. She also had a lot of stress going on, being a sandwich generation, and so it was important to also see, have a coach, have a therapist. She was able to spend time in nature. She was doing short breathing exercises, etc., and that allowed her to actually, look at a bigger picture and be able to say, you know what, I'm going to have my kids, volleyball practice. Like, I'm going to have, ride share, so one time, this mom will take all the kids, another time I will. So instead of her being 4 days a week, or many nights outside, she was able to find some balance in her evenings as well. So in summary, I wanted to say, what we have gone over today is looking at the mind-body connection and how intricately they are connected, appreciating that. And as we know, in my previous webinar, I had talked about gut and mind connection. And we know that, there's always a crosstalk. In fact, there are more communication from gut to the brain than brain to gut. But there are, hormones we also learned about that are talking to each other: the cortisol, estrogen, thyroid, and insulin. These are key to our women's health. And for energy, we learned how to rebalance the hypothalamus pituitary adrenal axis. And this can actually mitigate, we can help deal with stress much better. And the perception of the stress can also improve. So there is that difference between stress coming at us, but how is our reaction and our perception to that stress? Whether it's that email, or, whether it's the news on TV, or, something else, how am I perceiving that stress is absolutely important. We also learned how to improve our sleep and our nutrition to help restoring the hormonal balance. And these are really very interconnected, as you see. So I invite us to, if you're interested, if this was something that resonated with you, we would love to hear from you. You're welcome to schedule a free consultation. It's a complimentary consultation with our wellness coordinator. You can call us at this phone number, 833-767-3925, or come to our website and schedule that free complimentary consultation with our wellness coordinator. Okay. And I hope this was resonating with you. I hope this was a meaningful conversation. We will send you the recording of the slides. So please know if you weren't able to listen to all of it, and there are some people who were wanting to attend and weren't able to attend. So we will send recording to you at the, as soon as possible in this coming week. So I invite you to really start that journey. Before the January New Year starts, I want us to have a head start on our goals for 2026. Look at how are we going to navigate the holidays now, and how are we going to set ourselves up for success and good health in coming year in 2026. So I invite you to look at root cause, figure out your symptoms, and we'll help you create a treatment plan that will work for you, that is personalized based on your preference, on your previous experiences, and what has worked in the past. So I look forward to seeing you. We do telehealth visits, we do in-person visits. We're in a very central area, Upton, Virginia, but also look forward to seeing you in telehealth. So thank you for that.